Good afternoon, everyone. Today we will be providing an informational presentation on Nevada Battle-Born state plans. My name is Melinda Southard. I'm a Deputy Administrator here at the Division of Healthcare Financing and Policy, and will be leading today's presentation. Before we get going, we wanted to provide you an agenda for what we will be covering today, as you can see here. As passed through the Nevada legislature in 2021, now codified to Nevada Revised Statute 695K, the director of the department is required to contract with health insurance carriers to offer public option plans, which are now referred to as Battle-Born State Plans or BBSPs. These BBSPs will be listed as qualified health plans, which are otherwise known as QHPs, on the Nevada Health Link beginning in plan year 2026. Among other stipulations, NRS 695K requires carrier submission of a good faith bid to offer BBSPs if they would like to participate in the Nevada Medicaid Managed Care Program. The law also requires establishment of a reference premium, along with a premium reduction target that is at least 15% lower than the reference premium over a 4-year time frame. It is also required by law that participating carriers pay their BBSP providers no lower than Medicare average rate for a service, and providers participating in the Public Employees Benefits Program or Medicaid to also participate in at least one BBSP network in their rating region. Statutory goals of the program are aimed to reduce individual market health insurance premiums and consumer out-of-pocket costs, improve access to high-quality, affordable healthcare, reduce disparities in healthcare access and outcomes, and improve the availability of coverage for our residents in rural areas. Along with the BBSP program, the director of the department is also directed through state law to seek a state innovation waiver under Section 1332 of the Affordable Care Act. This 1332 waiver program is referred to as the Market Stabilization Program and involves implementation of the following initiatives, including a state-based reinsurance program, which is aimed at alleviating any unexpected financial risk to participating carriers and their provider networks with the introduction of the BBSPs, a quality incentive payment program to reward high-performing BBSP insurers, and a Practice in Nevada program to provide financial incentives to providers coming to the state to increase the state's healthcare workforce capacity and address the significant imbalance between provider supply and demand in Nevada's market. In addition, Nevada will implement a targeted premium relief program for enrollees whose premiums increase due to the BBSP program's premium reduction requirements. Rate increases are estimated for some exchange enrollees at about $5 or less, for less than 20% of the exchange population. The 1332 waiver application that's required under state law is required to capture any federal savings and waive any rules that are necessary to operate this program. In our administration with Governor Lombardo, put together what is referred to as the Market Stabilization Program. This is to ensure that these new plans will not disrupt the market, and we're able to ensure we're reinvesting into the marketplace. Here on the left, the first thing that will happen when these federal savings come in, that they will be invested into reinsurance. If our waiver application is approved, we will get the savings from this program and use it to fund our reinsurance program first, which will apply to all individual plans in the market to help subsidize those high-cost claims in the market and hopefully help reduce any risk of cost shifting. Whatever money is left over in year 1 or 2 and ongoing, we will be using for quality incentive payments to any carriers who participate in the BBSP program. This will be as an annual bonus payment for plans that meet certain quality metrics or whose providers participate in value-based payment design. The third item in this waterfall funding will be investing in workforce through a loan repayment program for healthcare providers who live and work in Nevada. Next, we'll go over some key BBSP policies. The division has designed requirements that are focused on promoting both healthcare affordability and quality for insurance carriers who are offering BBSPs. These new policy requirements include, first, compliance with QHP requirements. This means that BBSPs must comply with all state and federal laws and regulations that apply to QHPs that are offered for sale on the Nevada Health Link, and also those health insurance policies offered through the individual market. Second is regarding the metal level offerings. Carriers offering BBSPs will be required to offer at least one bronze, silver, and gold level BBSP, plus at least one non-BBSP QHP at the silver level in each applicable geographic rating region. Next, we will have premium reduction requirements, meaning silver level BBSPs must meet annual premium reduction targets, annually calculated by the state. Silver medal level BBSPs must meet the total premium reduction target of 15% by the year 2029. Continuing with the new policy requirements for carriers offering BBSPs. So next here we have network adequacy. This means that carriers offering BBSPs must prioritize contracting with essential community providers. BBSP carriers will be required to create, implement, and report on a comprehensive plan to improve access to quality, culturally competent, and value-based service providers for BBSP enrollees. Continuing on is policy requirements surrounding provider reimbursement. Except as otherwise provided in statute, BBSP network provider reimbursement rates must be, in the aggregate, comparable to or better than reimbursement rates available under Medicare. This is inclusive of add-on payments or other subsidies under Medicare and exclusive of Medicare payments for patient encounter or cost-based payment rates under Medicare. Lastly, we have marketing and outreach. BBSP carriers will be required to promote marketing and consumer outreach for the BBSPs. Carriers will be required to develop consumer outreach campaign proposals subject to review and approval by the state. Moving on to next steps and timing for the BBSPs. As many of you may know, the updated BBSP solicitation was released on October 2nd, with good faith bid proposals due October 23rd and technical proposals due October 31st. The division plans to send notification of good faith bid determinations to interested vendors by the week of November 6th. Whereby interested vendors determined to have submitted good faith bids will be eligible to proceed in the Medicaid managed care procurement. Nevada intends to issue a notice of intent to vendors around February 1st of 2025, with the following notice of award issued 1 month later around March 1st. Following Board of Examiner review and approval, BBSP go live date will be January 1st, 2026. Where BBSPs will be offered for purchase to consumers on the Nevada Health Link. With that, I will thank you all for viewing this presentation today. I hope you found it informative and have a great rest of your day.